Hi, I'm Chalene Johnson. I'm here with Dr. Michaela Sarno, who's answering many of my questions and your questions specifically about EMDR therapy. It's something that you've heard me talk about in my Car Smart programs, at my live events, and it's something that I've just been fascinated by because I've seen the amazing results that people have gotten from it.
Well, EMDR stands for Eye Movement Desensitization and Reprocessing. And basically what it's doing is taking people who have stuck memories and we're unsticking them. So we look at what those thoughts are, what that negative belief is and where it comes from, what part of their life, and we hone in and focus on that. Now the reason that EMDR is so effective is because we're really focusing on core events and where those beliefs come from.
Okay.
And that makes it very different than conventional talk therapy.
I have to tell you that the other day, and I shared this with you, my son said to me, "Mom, how come you have like so many friends that go to therapy?" You know, it's only a 15-year-old boy could ask, right? Who knows everything. And I thought about it for a minute, because I thought, that's kind of a good question. How come I do have so many friends in therapy? And then I realized it's because I have really, really smart friends. Being a whole package is finding experts to help you be your best. Why wouldn't you go to someone who can help you with that advanced form of thinking?
So it was created technically for veterans of war, rape victims, people of that nature. We use it now on addictions, anxiety, depression. It's pretty much used anybody
Obviously
who's a
weight loss,
yes.
And anyone who's a human being. That's right. Everyone in this room has issues, and that's not meant to be mean. It's just, if you're a human, you have issues. It just means you've had to deal with some things, and our brains don't always process them the way that they should, in the way that will allow us to achieve the type of success that we deserve. What do the people have in common who are able to lose the weight, keep it off, and then something about them seems to change, like who they are and how they feel about themselves? And what I found is that their common denominator for most of them was dealing with some issue from the past, like getting a good therapist.
Okay, well, we know that when somebody is gaining weight or using food as an emotional comfort, that we look at this as emotional eating.
Okay.
Why are they eating emotionally? Where is that coming from? So we go through their history and we look at some of the events in their lives and where that might be causing them to want to eat emotionally. Then we pinpoint exactly what those memories or those events were and what that negative belief about themselves that they're constantly hearing in their heads. And it's really easy because if you ask someone, you know, that self-talk that we do, you hear yourself, God, I'm so stupid, or God, I wish I would, and people...
I'm so fat, I'm so ugly,
right.
Everyone thinks I'm fat. Even when people are thin, I'll hear people say that. They'll say, you know, I've lost the weight, and everyone tells me I look great, but I still feel like ugly and fat.
And we change the negative belief through EMDR so that that block is gone. So we have two parts of our brain. In the back of our brain is the survivor part of our brain, and it tells the frontal part that processes things to shut down when it's too much or it's overwhelming.
Yes.
So when we're doing the back and forth movement, we're distracting the survivor, so now the front part can go into REM, sleep mode, and process while you're awake in the same way that when you're sleeping.
It's so cool. But when you do this, it is almost like you're dreaming, but you're fully awake. But normally, you know how like there's something that's troubling for you, and you go, I don't want to think about it. I'm just, boom, it's gone. Like you give it a split second, and then you move on past it because you're like, I'm over it, and I'm not going to go there. And our brains are really powerful at allowing us to do that. But when you're doing the EMDR, you can't. But it's not painful. It's weird. It's like you said, stuck. It's like normally you go, here's that thought, and boom, I'm over here. But when you're doing the EMDR, you're like, okay, here, I'm in that thought, and now I'm going to process it. I'm going to untangle it. This is not painful. This is not that bad. And then when you finish, you're like, wow, I just untangled this whole mess that I've been avoiding for 20 years or 30 years or 5 minutes. And what I love about EMDR, and what I've heard from so many of our friends and associates and very, very successful people kept hitting the same roadblock, was that they were astonished how quickly they took something they've done therapy, struggled with depression, struggled with failed marriages, struggled with failed businesses, and in less than 3 sessions, they've wiped it out.
3 sessions, 80 to 90% success rate.
You said something to me the other day that I was like, oh, that's brilliant, because we had a friend who was afraid to do the EMDR because she said, I don't even know where I would start. there has been such upheaval in my life. I don't even know, how I could afford to deal with each one of those individual memories. And you called a term that you use a push trauma. So explain to people what a push trauma is, how there's this one event that sometimes kind of knocks down the other ones.
Well, a lot of people come to therapy and their first thought is, I'm going to have to go through every event, which is conventional talk therapy types will have you do that. But with EMDR, we look at the earliest memories first, because it's a domino effect, and it might affect.
The earliest, most traumatic memory, the earliest, most disturbing memory, what?
Pivotal memory.
Pivotal.
Life-changing memory.
Okay.
A memory that has some clout behind it. If we just get ourselves into a position, which is what EMDR does, our brain will do the work for us. So that's what makes EMDR so easy. A lot of people think, am I going to be able to do this right? You can't mess up EMDR. That's what's so great about it.
I love that. That's the permanent part of it. And that's why I'm so excited that you're partnering with Hotel Park City. Now, they've done this an amazing camp that really is a life-changing opportunity for people who are looking to really kind of revamp their whole life, like figure out why once and for all they've been out of shape and have let their health become second, to everything else. And they have put together a program with yourself, which is, I think, the only one I know of in the country where, hello, it's a weight loss camp that's finally targeting the one muscle that has the biggest effect. That's great. You can teach me how to do squats and make me run up and down hills, and that's great. You can take me out of my environment where all my bad food is. But once you put people back, if you haven't changed this, all those bad habits come up again. So it is brilliant, and I have to say hats off to them. I am their biggest fan because they found someone like you to come and change people's lives. So tell us how that is going to be integrated in, and a little bit more about the program.
Changing their body is kind of, surface. That's, they're going to go in, they want to change their body. We want it to stick, and that was the big thing, is that anybody can go to any one of these weight loss camps and they're going to lose the weight there, and then they're going to go home and they're going to go right back into the same behaviors. So they're going to be pushed and to work out, get into their fitness, but they're also going to be working on why are they emotionally eating, where is this coming from, and what are some of those negative beliefs. So they're getting the full package. They're going to have therapists, nutritionists, trainers. They're going to have everybody there so that it's a full spectrum program. I'm so excited about Inspire.
What's the website name too?
InspireFitResorts.com.
InspireFitResorts with an S?
With an S.
.com. Okay.
.com. So all the therapists are EMDR therapists.
Yay,
okay.
That's awesome.
And regardless of how long the individual is there, we can use EMDR with performance enhancement, meaning when they leave there, what are some of the things they want to conquer, what are some of the things they want to do. We can use it in that way.
So this is a weight loss retreat. It's in Park City, Utah.
Park City,
which
Utah.
Is beautiful.
Park City Hotel, which
Park
is
City
a
Hotel,
beautiful
which we
resort.
stay there many, many times. Love it.
It's an amazing resort, and they're going to stay there. It's a 30-day program. They can stay 6 months.
Very luxurious, by the way.
Very luxurious. They can stay as long as they want.
Okay.
But they're going to get all of the fitness aspects that a weight loss program would offer.
Meaning they're exercising every day with?
Turbo kick, plyo. You have all of the mountain biking, all the outside. I mean, you have all the outdoors there. So they've got all kinds of exercise formats for each person.
Got it.
And then additionally,
customized, I assume.
Customized. And additionally, you get a 90-minute session every week with an EMDR therapist. So you're going to have...
I have one thing to say.
Yeah.
Duh. I mean, duh. We're not just fixing your diet. We're not just fixing your exercise. We have to fix the whole person so that when you go home, you're not looking for another resort to go to next summer. Permanent. So I'm really excited about what they're doing there, and I hope that you'll check it out. And if you would like more information on pricing or information about hotels, etc., more information about your 5-day intensive, they can reach out to you where?
MichaelaSarno.com.
Okay, there's a contact info there?
There. You can also go to EMDRThoughtTraining.com.
EMDRThoughtTraining.com and MichaelaSarno.com, and right there, can they see it? Is the 5-day intensive right on the homepage?
5-day intensive all over the place.
Sweet.
Right from the front page.
Awesome.
Okay.
Cool. Thank you, guys. If I had to use one word to describe my closest friends and my some of the people colleagues who have gone through EMDR, if I used one word to describe the change in them, I would say calm.